Doctor, talking about Tocotrienols SuperBio, we've talked about how it might benefit promote brain health. How about Alzheimer's disease? That's another one that I think is affecting a lot of people.
So when you break into a field, you break into a principle. You do not break into applications. When you're given a principle, such as in this case the principle being tocotrienol being a neuroprotective agent, then the applications are many and lends itself to testing against Parkinson's disease or age-related neurodegenerative disease, Alzheimer, so on and so forth. We ourselves have not done those studies, but I would not be surprised if you have positive results in those, because eventually these are all neurodegenerative, and we are talking about tocotrienol being a neuroprotective agent.
Okay.
And actually more than that, neuroprotective agent is what we thought it was, which is true, and we are getting more and more of the mechanism, but now we see that it also helps in supplying more blood to the stroke affected side of the brain. We just published this in 2011, suggesting that tocotrienol also has an influence on the brain vasculature, vascular supply, and how the vascular function works. So more and more mechanisms of action are coming into sight, leading to the notion that tocotrienol really functions via a multi-mechanism manner, not just a single target manner, as was once thought to be the holy grail of drug development. Let's target a pathway. We are gradually learning that it may not be the way to go, because any disease process is really fed by a multitude of pathways. If you block one, it will find another to trigger. So it really have to be a multi-pronged approach to really take care of a disease system, and that's what we are seeing with tocotrienol.
So that said, are there other studies out there that might open the doors or avenues for other treatments with tocotrienols? Is there other things maybe on the horizon that this might
there are claims, there are other studies, not from my laboratory, but from other laboratories, that are claiming cholesterol lowering effects. Okay. There are claims related to improved lipid profile. There are claims related to anti-angiogenesis. There are claims related to improved outcomes in experimental cancer, so on and so forth. There are claims related to anti-inflammatory effects of tocotrienol. Now, any one of these claims is only the beginning. We have been, I think, one of those labs. I don't know if there is really one other lab that has been working on one claim for that over a decade. Our lab has really made a claim a decade ago, and a decade later now, we are taking it to the humans. So that's how long it takes to really mature a claim, make sure others can reproduce what you are claiming, and then credibly take it to small animal, large animal, human. So this is a long journey, and a claim is a claim. You see it, this seems to be promising, and then sometimes it may vaporize based on the model that it was specific to the mice and did not work out in another system, so on and so forth. But the neural claim that we have really has been hanging around for a long time, and now multiple laboratories are working on it.